In this video, I answer a common question I get daily on why stretching doesn't seem to have any long-term effects on reducing tight and sore muscles. For those of you who don't know me, my name is Dr. Matt Maggio, and I'm a chronic pain treatment expert with over 15 years of experience, specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in overall functioning, flexibility, and long-lasting pain relief. It's a quick disclaimer on why I make these videos. I don't make them to entertain, but specifically for anyone that has been dealing with chronic neck, shoulder, elbow, or wrist pain for at least 6 months. They've tried just about every type of treatment. They've been lied to, overpromised, and underdelivered by the current medical model, really in hopes of giving some real answers as to what is going on and get to the root cause of the problem to get some long-lasting pain relief finally. Now on to the video. So I get this question probably several times a day across all of our channels. The question usually is something like, why are my muscles always so tight and sore, even though I spend a lot of time stretching, foam rolling, doing yoga, and getting monthly deep tissue massages? So what am I going to cover in the video? I'm going to cover first the most common causes of tight and sore muscles that can't be fixed just by stretching. Next, why does stretching only produce temporary relief for tight muscles? And how to get long-lasting relief from tight and sore muscles without having to spend a lot of time stretching. So talk about this stuff all the time. It's called adhesion, also known as scar tissue. Basically what happens is over time with bad posture, stress, lack of movement, maybe too much exercise, the muscles get constantly stretched and contracted. When this happens, it doesn't get enough blood flow, doesn't get enough oxygen, so it sends a signal to the brain that there's some type of damage there. Body starts pumping out this stuff called adhesion. It's basically just immature collagen fibers that go in and try to seal up the muscle to help it be able to handle the load. It's really just trying to do something in the short term, but then it builds up in there more and more. It's kind of like plaque on your teeth that builds up over time. Like I said, it's made up of collagen. So collagen is like the building block of muscles and tendons and ligaments and all the structures in your body. But what happens is when this is constantly happening, the body pumps out the collagen before they're fully cooked. So it's actually not the best type of collagen, just kind of throws it in there. And if you look at this photo here, the muscles are getting stretched over here. And on the other side, it's just kind of like someone just threw a bunch of garbage in there. And it's just all disorganized and doesn't really function how it's supposed to. When this does build up, what happens is first it makes the area less flexible. So it can't really stretch and move how it's supposed to. And then eventually it also makes it weaker because the muscles can't contract how they're supposed to and have all the strength because all that adhesion is in there. And then eventually what happens is the force starts to go to other structures. It ends up going to the bone, the cartilage, the disc, and the tendons, and it creates this stuff called degeneration because force has to go somewhere. So when the muscles can't produce force, they kick it on to other things. Then another big problem happens is the nerves get stuck in that muscle with all that adhesion. Nerves are built with about 15% of extra slack, like a rubber band to keep them healthy, and it makes its way through the muscles and stretches and goes where it needs to go. But over time, as that adhesion gets bigger and bigger, eventually it gets glued to the muscle, and this causes a nerve entrapment. When someone has a nerve entrapment, it usually presents first with some numbness or some aching or some burning, maybe a little bit of tension as well. Very pinpoint as well in the area where it gets caught. And then a lot of times people will go to a massage therapist or physical therapist that does soft tissue work, maybe a chiropractor, and they go in there and they find these areas where these nerve entrapments are happening and they try to isolate them, but they actually think there's this thing called a trigger point. A trigger point is actually a response in the muscle to something else happening. It's still a healthy muscle. What actually happens here is it's that nerve entrapment and that adhesion, and then when they treat it, they usually are just way too compressive. They kind of beat the hell out of the area, and it doesn't do much of anything. Temporarily makes it feel better because you're moving some stuff around, but it's not actually fixing the problem. And in the treatment process, when we're trying to restore range of motion, get function back to the tissue, get it healthy, we have to treat the nerve entrapment first because the body really has a hierarchy of what it does to protect the area. And if the nerves are getting caught, it's going to cause everything else to not move how it's supposed to. You might see differences in the posture, how things move, because the body really doesn't want the nervous system to get damaged. Because if the nervous system gets damaged, nothing else works. So it will sacrifice a lot of other things around there to take the pressure off of the nerve. That's why we have to start by fixing the nerve entrapment first before we fix anything else. So, how do I use a rubber band? There's me, smiling with a rubber band over there, to determine if something is a viable treatment option. So, first is just stretching. So, a lot of people think their muscles are tight and they just need to stretch them. I always say the question of why are your muscles tight in the first place? And a lot of times it's because of that underlying nerve entrapment or that adhesion. And when you stretch it, all you do is kind of pull it apart. You're not actually breaking down that nerve entrapment or that adhesion. You're just kind of pulling it apart and it temporarily feels better, but it's not actually fixing the problem. Next is foam rolling. Same concept. You're just really putting depth down into it, but you're not getting any tension on it. So when you're doing stretching, you're getting tension, but you're not getting depth. When you're doing foam rolling, you're getting depth, but no tension. You need both components in the treatment process to fully break this problem down. Deep tissue massage, same component. They're going in there deeper. They're applying some compression and some depth to it, but there's no tension involved in there as well. So they're always getting one of the two factors, but not both. You have to get both in order to get that long lasting relief and get it functioning better. Chiropractic adjustment, it's really not doing anything to address any of the tight muscles. It might temporarily feel better, but most of the time what I'm seeing is it isn't actually the bone problem being out of place, it's the muscles and the soft tissue that have pulled it out of place. And if you're just adjusting the bone, but you don't actually fix the soft tissue, it's kind of like the brick went out of place, you continue to put it back in place, but you didn't fix the mortar, which is the soft tissue. So you got to fix the soft tissue instead of doing the adjustment. And why do all of these treatments temporarily reduce tightness and soreness, but never seem to last? I'm going to try not to get too fancy here, but basically in your spinal cord, you have this path called the lateral spinal thalamic tract, LSTT for short. And what it does is it has two types of things that travel on it. One is vibration and movement, and the next one is pain. So when you do a stretch, you do some foam rolling, you get a deep tissue massage, you get an adjustment, what happens is you stimulate all those receptors that do vibration and movement, and what they do is they kind of block that pain a little bit, and then you get this temporary window where things feel a little looser, they feel a little bit better. It's kind of like when you jam your thumb in the door, you kind of shake it out to take some of the pressure off of there, but it didn't actually fix the problem. It's kind of just confusing the brain. So a lot of those other treatment methods to try to get the muscles less sore, moving better, function better, temporarily do some stuff, but they're missing the components of proper depth and then proper tension to go in there and break it down. And they're really kind of just playing a trick on the brain where you do temporarily feel better, but it didn't actually improve anything to the function and the overall health of the tissue. So, how to get long lasting relief from tight and sore muscles without having to spend a lot of time stretching? First is we say always start with a full injury consultation, basically going in and getting with a provider that doesn't just jump right into treatment. They're not like, oh, it hurts here, let me start working there. They ask you some detailed questions. They really get to the root cause of what's going on, asking you pointed questions about where the pain is, what you're feeling, what you've been through. We're really starting to formulate an idea of what's going on because you can't fix a problem in the first place if you don't know what it is. Then we do a functional based evaluation with lots of data. As we're taking you through tests and measurements and motions, we're able to isolate exactly where the worst of that adhesion is, where the worst of those nerve entrapments are, so we can know exactly where to go and and fix it. Then, when we know for sure which structures are limiting that range of motion and causing weakness, we're able to get in there very precise and very focused. With our hands, sometimes we do use an instrument, but we get proper depth and then proper tension. As I said earlier, a lot of those other treatments, they get a lot of either depth or a lot of tension, but they don't get both. You have to get both in order to actually successfully break down that adhesion. When we're doing the treatment, I always say to the clients, the treatment should be a little bit uncomfortable, but never excruciating. If you're going to a provider and they're just jamming their elbow in you, putting all their body weight on you, stretching you and ripping your leg above your head in hopes of trying to restore mobility, it's just going to make the problem worse. Yeah, it temporarily feels better, but it's not actually going to fix anything. Then another thing that's really important is after you get the treatment done, there should be tests and measurements after the treatment to know that some type of change is being made. Not just like, hey, how do you feel? It's like, hey, we measured your shoulder function and it was here and now it's up here. We're seeing an improvement. Those are real improvements. We want to see real improvements in the data and the movement to know we're actually on the right structures that are blocking that movement. Then usually we give the clients a few days off and they come back and we start the next treatment session with the test that we ended with. And we want to see how much of their progress they kept, how much of their movement they kept. That's how we know we're making long lasting changes into the tissue and allowing for more long lasting pain relief, better function across the board. And usually when I see a client that's been dealing with a problem for a long time, it usually takes us anywhere from 6 to 12 treatments to get it fully resolved, getting all the tissue healthy, getting everything out of there and getting it functioning and moving better. Then, once we do that, things like stretching and rolling and regular massage can really help to keep the adhesion from coming back as extreme and building up more and more. I always say this first round of treatment with a provider that specializes in our treatments called the peak method is really like going to the dentist and getting a cavity drilled out and getting it cleaned up. And then all that other stuff like, foam rolling, massage, stretching is like brushing and flossing, keeping it from coming back and being a cavity again. And then once it is in a good place, we do recommend like periodic treatments to come in and get some of the muscles cleaned up because you're going to accumulate some adhesion as you go through life. It's just part of life, but it's a lot easier to come in and get like a quick cleaning before it becomes a cavity again. So that's why I'm really big on maintenance and stuff like that. And typically our clients usually go anywhere from like 4 to 6 weeks. So it's a lot easier to come in, get it cleaned up before it becomes the problem again, and then you're not back to square one and having to start all over again. So if you're dealing with tight muscles, stretching all the time, doing the deepest of massages, getting adjusted, and just kind of feel like you're never actually getting better, there are some people that can help. And the best providers in the world for treating chronic tight and sore muscles naturally are trained in my system called the peak injury treatment method. And when you've had enough of stretching, foam rolling, or getting the deepest of massages only for a day of relief, then reach out to us directly and request a no charge injury consultation to get some real answers as to what is going on and on the path to long lasting pain relief. Links to request a consultation are included in our profile or wherever you're watching this video. I appreciate you watching, and we'll see you on the next one. Bye.